Welcome back. Today is April 7th, 2026, World Health Day. While we celebrate global health progress, today is also packed with massive regulatory shifts, the One Health Summit in France, and a literal needle-free revolution in weight loss. We're breaking down the 5 stories you need to know to stay ahead in medicine.
Story 1, World Health Day and the One Health Movement.
The big news, the World Health Organization, WHO, has officially launched its 2026 campaign, Together for Health. Stand with science. Key event, the International One Health Summit is currently wrapping up in Lyon, France. Why it matters, this isn't just a meeting, it's a global strategy linking human, animal, and environmental health. Focus areas, scaling up digital surveillance for outbreaks, like the integrated dengue response in Bangladesh, and antimicrobial resistance. Policy shift, who is assuming the chair of the quadripartite, FAO, UNEP, WHO, WOAH, tomorrow, signaling a massive push for multisectoral action on pandemic preparedness.
Story 2, the needle-free GLP-1 revolution.
Breakthrough, the FDA just approved Foundayo, or Fergliprin, the first ever GLP-1 daily pill for weight loss that can be taken any time of day without food or water restrictions. The disruption, unlike Wegovy or Zepbound, which require injections in strict fasting windows, Foundayo is a non-peptide oral agonist. Impact, this dramatically increases scalability. We're seeing a shift where obesity management is moving from specialty injections to accessible primary care tablets. Pricing signal, to compete, Novo Nordisk has launched a self-pay oral Wegovy tablet at just $149 per month for lower doses in the US.
Story 3, major FDA approvals and rare disease wins. New approvals, April week 1.
A weekly, insulin icodec, the first once-weekly basal insulin for type 2 diabetes, is now hitting the market. Avlaya, tividenofusp alpha, a breakthrough for Hunter syndrome, MPS II. It's the first biologic engineered to cross the blood-brain barrier. Spinraza, high-dose Biogen secured approval for a higher-dose regimen of Spinraza for spinal muscular atrophy, SMA, to prevent treatment waning. On the horizon, keep an eye on April 10th. That's the PDUFA date for several high-stakes obesity and FSGS, kidney disease, treatments.
Story 4, the AI clinical workflow takeover.
Trend, AI isn't just a gimmick anymore, it's a workflow engine. Tool update, Epic's AI assistant, ART, is now reported to cut clinical documentation time by 32% and improve lung cancer detection to 69%, compared to the 46% national average. Google and CMS, Google and the Centers for Medicare and Medicaid Services, CMS, have partnered to bring medical records directly to Fitbit, effectively turning wearables into clinical data hubs. Admin reform, CMS has finalized a rule to eliminate fax machines in healthcare, a move expected to save the industry $781 million annually.
Story 5, public health and consumer alerts.
Diabetes awareness, medical dialogues in care hospitals are reporting a rise in lifestyle-driven diabetes. The message today, small changes in blood sugar management now prevent the overnight onset of chronic issues. Insurance news, in a rare win for patients, major U.S. insurers like UnitedHealth and CVS have agreed to pare back some prior approval requirements, particularly for imaging and cardiology.
Measles, mumps, rubella, 3 vaccines in 1.
The big 3 childhood diseases, measles, mumps, and rubella, MMR, can hit harder when you're an adult. One MMR vaccine protects against all 3. Most American adults have either had the measles or been vaccinated against it. If you haven't, you're still at risk for this highly infectious virus. Even worse, you may be at risk of serious complications such as pneumonia and encephalitis. WebMD.
Delivering intravenous 4 antibiotics at home.
Delivering intravenous 4 antibiotics at home, supported by telemedicine monitoring, offered a safe and cost-effective alternative to prolonged hospitalization for complex cases, early findings from a pilot study suggested. The approach combined outpatient parenteral antibiotic therapy, OPAT, with remote monitoring and was found to reduce hospital stay and healthcare-associated risks while maintaining high treatment success rates in an older, frail, and multimorbid population. Medscape.
Autism spectrum disorder, ASD.
The widely held assumption that autism spectrum disorder, ASD, predominantly affects males may reflect diagnostic patterns rather than true differences in prevalence. A large population-based study showed females are more frequently diagnosed later rather than in early childhood like boys, narrowing the gender gap in ASD prevalence over time and resulting in nearly equal lifetime rates between the sexes by adulthood. While boys were initially about 4 times more likely to be diagnosed with ASD than girls, that gap began to close at around age 10 and continued to shrink as diagnosis among girls increased during adolescence. By age 20, the ASD prevalence was approximately 1:1 between males and females, Medscape. Call to action, that's your medical briefing for April 7, 2026. If you found this update useful, hit that subscribe button for your daily dose of medicine.
Call to action.
Which of these stories surprised you the most? Let me know in the comments below. Don't forget to like this video and subscribe for your daily medical news update. Stay healthy. Disclaimer: this script is based on general medical information. All information must be verified before use. The creator, publisher, and YouTube will not be liable or responsible for any negative consequences.